Hi, this video is the art of hair transplant restoration surgery result on a black African American woman who had a procedure done by me over a year ago. It's over 3,000 grafts, and Eugenia gonna share her experience with us from before, how she found me and how hair affected her, and then what surgery they look like and what she do to hide herself during the recovery and a year later. And before we do that, I'm going to show the audience what she looked like before. So she is thinning, and it's genetic. It's very unique among black women to have this type of hair loss, I'll tell you. And so she's thinning mostly on both sides, and that's before, and this is a year later. You see full density, more than an inch. We did over 3,000 grafts for her. And again, this is the right hand side. You see how an inch thin. On the right side is less thinning than the right, but we fill it in for her. That's full density. And you see the top view, we did an inch. And she did not want to really lower her hairline to change who she is. She just wanted a natural hairline that she's supposed to have. Just like Destiny Godly, they want a high hairline, but it's natural who she is. And so, I'm going to put the stage back to Eugenia, and she's going to share her experience from the beginning.
Thank you, Dr. Diep.
Okay, so go ahead.
I can't believe it's been a year. Oh my gosh. So let's talk about how the hair loss affected me. It was very embarrassing. I wore weaves for years, and basically from that it causes tension, alopecia. After I took the weaves out of my hair, I thought that the hair was going to grow back, and it didn't. So I tried to cover with creams and gels and all those type of things, and it never happened. It never grew back. One night I was online, and I ran across a video by a video blogger. Her name is Destiny Godly, and she also had her hair, a hair transplant done by Dr. Diep. She did before pictures, after pictures, months later, pictures down the line. And I was so taken back by her journey and her growth that I too wanted to find Dr. Diep, and which was so great is that I live right up the street and he's right here, so I came right in to visit him. I chose Dr. Diep mainly because he specializes in black hair care, and you see online a lot of doctors, they want to give you a Caucasian hairline, meaning that they give you this straight hairline right across your forehead. And that's not what I wanted. Dr. Diep said to me, he said, oh, well, do you want to lower your hairline, or do you want to keep your hairline the same, or do you just want to fill it in? And I said, I just want to fill it in. I want to look the same, I want to look the same. And he said, okay, well, you see these baby hairs right here, we're just going to bring it down to the baby hair. And that kind of blew me away, because he knew exactly, he knew my hair. He knew how to talk to me about my hair. Surgery day, I came in. He took me back to his office. He made me very comfortable. He gave me a few medications just to relax me, and then he started with my surgery. I woke up to a cheeseburger, a good cheeseburger at that, a good cheeseburger, and then after I ate my food, I went back to sleep. And when I woke up, I was done. I went back to the hotel he provided, and I went to sleep. And he told me, you need to sit up, don't wrap your hair in anything, just sit up and try to sleep as well as you can. I did. I came back the next day. One of the staff members washed my hair very gently. She was very patient, really nice. She answered all of my questions, and then I went home. And every time I had a question, every time I felt insecure about something, this is a process. This is not going to heal overnight. It's not going to happen overnight. So you definitely have to be patient. But every time I had a question in regards to my hair, when will it grow back? How do I wash it? What do I use? There was always someone there. There was always someone there being patient with me. I felt like someone was holding my hand right there, right as I was standing in my bathroom having a nervous breakdown. So, my hair is totally filled in. We are a year out. My girlfriend actually noticed the hair growth before me. She saw it maybe 4 months ago, and she said, your hair looks really, really good. And even a few weeks ago, my mother was in town, and she put her hands through my hair, and she was so excited about the hair growth, and she told me, you know, how to put some product on it to make it lay down a little bit better. But for the most part, maybe 4 months ago, that's when I really started to notice the hair growth. But 6 months back, I saw little fuzzies, but up in maybe 4 months ago, that's when I really started to notice the hair growth. I'm so happy that my hair has grown back. I'm so happy that I have a hairline. I'm so happy that I have edges, that I can wear my hair out, that I don't have to cover with fiber, thickening, any type of anything. I feel comfortable enough to wear my hair out in a ponytail. My hair is actually long. So I'm happy to be able to just wear it again, just to have it out and free and not hiding it from anyone or even myself. So I thank Dr. Diep for that. I thank Destiny for leading me to Dr. Diep. And if you guys have any questions, I feel like you should contact him, and he'll be able to explain everything to you. Yeah.
Thank you, Eugenia, for sharing your experience. So right now, it's a year out. So the hair length is not that long yet. We're talking about a few inches long. But in another year, the length's a lot longer, so you can style a lot more better. And the density will improve up to a year or year and a half. And Eugenia is such a beautiful woman, and basically when we have the hairline increase her density, it frames her face and it brings out her eyes and nose and all the features that God gave it to her. and it's true. And the most important thing is not, it's very natural, and people will not be able to detect it. Eugenia, can you share? I know a lot of the audience, they worry about hiding it during the recovery, before they get back to work. Well, what should they do and all this stuff. So how about share your experience, one experience.
Okay.
And your hairstylist did it for you?
Okay.
Yeah.
So prior to me finding my hairstylist, who is also near Dr. Diep, I wore very light scarves on my head. I would maybe bun it to the top, or just kind of lightly wrap the scarf to the back, just something that I could cover my hair, cover my entire head, because it was a healing process. And I also work in an emergency room, so I didn't want any of the germs to get on my head. But for the most part, I just wrapped my hair with a silk scarf, something very light, something very vibrant and pretty. And there was always questions, but I would just say, oh, I like wearing scarves or whatever. And then I ran across a young lady. Her name is Mina. Her IG name is @MyStylistMina. And she also works with young ladies and men with restoration, hair loss problems. So she made a wig for me, which actually started back here with the crown of my head. And if I wanted a bang, she would start the bang here. She would not sew the hair down. She would just pin it with bobby pins so I could take it on and off at night. It was never tight. There was no friction to the hair that was placed. And if I wanted to change it up and wear a scarf, I could wear a scarf. If I wanted to wear the half wig, I could. I had options, so I never felt like I had to hide myself. I would put my makeup on. I would, dress up and go out. The surgery, it didn't affect me as much as I thought it was going to be. I didn't have to hide myself. I was able to go out and still do the things that I wanted to do, and I was okay with that. So, yeah.
Okay. So if you can, Eugenia, can you turn, look down. Good. Can you turn to the left? Let it go. See, hold that. That's full density right there. Now I'm going to show the audience what she looked like before. That's how she was before. And this is how she is right now. Excellent density. And turn to the other side. See, full density. And this is her hair, full length. And you can turn around toward me and look all the way down if you can. Okay, that's her, and you can look up. The most important thing is that the density will be there. The length, it will take a little bit longer than a year, but eventually everything will blend in. Most important thing is naturalness and density, and this is just one surgery. And so other people, they're not experienced in working with black curly hair, they kill most of the graft, and so the density won't be there, and then they might have to do multiple surgery for that, or the hairline, normal hairline. So this is Eugenia journey, and I hope your audience enjoy and understand what her journey is like, and give them at least give you guys hope, and what's it feel like to go through surgery and the recovery. I know sometimes people get scared doing the recovery, but we will be there for you, and I have great confidence that it will work. Thank you. Bye.